Good afternoon. Welcome to Tuesday Live with me, Vinod James. Welcome to Neetu's Academy Reading Live. Hope you're all doing lovely today. How was your day? It's another question to ask, isn't it? Every day it's bright and sunny. What else could you ask for, isn't it? Every day you get to know a lot of things. You get to learn a lot of things. And of course, it's because of your lovely participation that we are here at the very same place where we are. Because, see, to be very, very precise on the aspect. See, a class, see, for example, okay, just to make sure that you start understanding how vital your participation is. This picturizes this. Let's say you are attending a class with no active participation. So what happens? The trainer, everybody is also in the same way, isn't it? So what happens is, if you feel that your participation is not important, let me remind you, that is the most valued thing. Being a trainer, I know what is the value of your lovely participation. And hats off to each one of you, because you've been some tremendous audience on the aspect of come what may. Any day you come, you're always filled with a lot of positive vibe that you bring to us, and that makes us more positive. So thank you so much for rendering those kind of support. Abhirajan, good hi. Jilmi Joy, good afternoon. Gia Ibn, Maldives, good afternoon. Kavita Balaji, good afternoon. A very, 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 very good afternoon, or come what may, wherever you are from, a very good morning, a very good afternoon, and a very good evening to all my lovely students. Sharanya Rakesh, good afternoon. Tell me, how are you all? Are you all eagerly waiting for another lovely session with me? I am always, every time when I come for the live, I'm always very, very cautious on the aspect how many new students would be there, how many regular students would be there, and how many are going to tell me some valuable points, valuable insights. See, any point that you're going to communicate with us is an absolute valuable thing. Because when we started, when Neetu's family started the live, it was very much, it was gradually but steadily progressing, because the valuable feeds that you give us was what was more important, because we molded in accordance to what is your need, because you are a priority, because you are our patrons. You see our Telegram page. We have 2 Telegram pages only. So again, just to remind you, just to make sure that you all understand, there is only one is an official Neetu's Academy Telegram page, and then other one is an exclusive reading Telegram page. All are free access, but just to let you know. Amal KR, new name, good afternoon. Eva Ivan, good afternoon. Abhirajan, good afternoon. Anne Molshibin, good afternoon. Kalei, good afternoon. How am I? I'm doing excellent, Kalei. I hope you are enjoying your lovely life in resort in Maldives, is it? Excellent. So Kalei is one student who have made to her dream after her lovely hard-working effort. She has made to her dream and on the verge of going and making her dream a reality. So very sweet of you to come enter in between and to see how I am. As what you say, long time no see time no tea. Hope you're enjoying there. Yeah, good enough, good enough. So there are a lot of lovely students who keep in between. They come, even though they're busy with their daily life in their dream country, they come in between and just to pop and say hi. It's an honor to have those kind of valuable students, isn't it? You all are, which we have never, or which we never doubt about. Tina Rajiv, good afternoon. Ajit Kumar, good afternoon. Very nice to see. New names. See, this is what the beauty of the when you come and do a live is, the mix of students that we have. We have people who come in between and say hi. We have people who have been there with us. We have people who are new. So it's absolutely nice. Angelina Mo, good afternoon. Dumol, good afternoon. So I could see at least one icon next to your name. If you have not yet, please do click the like button. Please do click the follow button. Please do click the share button. Now, why all these? Because that shows that you're all there showing so much of love and affection towards us. Bibin Sebastian, good afternoon. Monica Vegas, good afternoon. Nisha Keynes, good afternoon. So I would definitely request all of you to have at least one icon next to your name that shows that you are. See, as you can see, there are a lot of students who have hands, there are students who have flags, there are students who have the number 1 logo, there are students who have the heart-shaped logo, there are students who have the number 2 logo. You name it, they have it. Priya Vishnu, good afternoon. Alex Simon, good evening, a very good evening. So nice to see a lot of people in front of me. New names as I've mentioned. Princey Thomas, good afternoon. Is there anyone who is attending my live for the very first time? Adyamayittu live attending. If there is, please do let me know that you're attending for the first time and where you're from. I love to tell to everyone that I have known people across the globe. Now see, Maldives, I have few people there, and even Kalai is there. If you look into Nepal, I had a lot of students from Nepal, Sri Lanka, Maldives, Mauritius, Afghanistan, Pakistan, different parts of Middle East, different parts of Africa, Australia, New Zealand, England, Ireland, Scotland, Italy, Canada, US, Malaysia, Thailand, Philippines, Indonesia, Singapore. You name the country, we have all the students from there. Grishma, good afternoon. How are you feeling? I'm doing good, Grishma. Thank you very much for that gesture. Anmol Shibin, me. Anmol, may I know where you're from, if you could, yeah? Jaya Lakshmi Ramesh, good afternoon. I'm glad to see you. I'm glad to see you as well, Kalai. Amidst, I saw a new ma'am taking class. I thought you were... No, I'm here with Neethu's family only. But of course, see, who doesn't love a change, isn't it? You've been looking at my face for a long time. Now we thought maybe give some, new fresh faces so that you are all happy with. So that's all. I'm from Italy. Very nice. I love that country. It's one of the most beautiful country that you can ever be. So you're one lucky person, and also, if at all I get a chance, that's in my bucket list, Italy. So you're very lucky. Okay, and which part of Italy? I have a lot of friends from Italy. Anmol Shibin from Italy. So I have, after some time, I have another student from Italy. Misha Vaibu, good afternoon. Steny PD, good afternoon. Tiara, always with a lot of flowers. How are you? Have a nice day. How are you feeling? Cold okay? Yes, Tiara. Very, very, very sweet of all of you. Yes, I'm getting better. No problem. But I didn't want to stop coming in front of you and seeing you all in front of me. So yes, and this is what that makes the difference, isn't it? When you are all there, taking that small break out of whatever that you're doing and coming in front of me. Turin, I know it's a very, very beautiful place. I have a lot of people from Turin as well. All right, good enough. Very nice to hear that you're from Turin. Good enough. I have people from Napoli. I have friends from, a lot of places. Turin is a place where you have the Italians who are mostly having black hair, isn't it? Torino. Yeah, I can't remember. It's right. So coming back to what we are here for, we are here to enhance our knowledge in reading. So yesterday I told you the importance of reading. How many of you have started reading on a daily basis? Tell me. Let me see how many of you are doing that. Reading is very, very, very important. You read whatever you like. It doesn't matter, but you have to read. Now to enhance that for 400, because as you can see, our students are always making us proud about their achievement. Initially when we started, our first target was 400. Now then our students started getting 400. Then now it have become 400. Now no sooner, mark my words, students will come with 400. That's the trust that we have in, with our students who are in. Fair enough. Abhirajan, I've started myself. Grishma, yes. Kavita Balaji, yes. Bibin Sebastian, yes. Very good, very good. So this is your first step to go to your, the ultimate destiny that where you are. Okay, because whether you like it or not, this verbal diary is not something that is going to have any say in the country that you're going. Everything is going to come your way as documents. So you have to start reading. And the next thing that I'm going to do is, in order to enhance that 400 out of 400, okay, the next thing is to ensure that how you read is a difference. Okay, Nisha Khain, you have started reading. See, generally we have a habit of, can you imagine any of those songs which are I started reading magazines. Fair enough, Jilmi, excellent. See, can you ever picturize singing a song in a very, a very monotonous tone? Would you ever enjoy that song? No matter, just picturize this. Your favorite song. And you are listening it as if you're reading at a very monotonous tone. Without any ups and downs. There's no high pitch, low pitch and all. It's the very bland pitch. Would you ever love that song? Or picturize this. I come in front of you and say, good afternoon. I am Vinod James. Welcome to another leading live session with me. Would you attend? Would you attend my live as like that? Anil Kumar, good afternoon. Lima Thomas, good afternoon. Would you attend? Tell me. If I would have come with a very bland tone, would you attend my live? Anmol Shibin, I just started 3 days before and my score is too less from part A. Do not worry, Anmol. Once you start doing, it will come to you. And you have to stick to your basics. So what I'm going to talk about, these are all something that we'll be discussing in. So because Anmol is there from Italy, and because I have a very fond affinity towards Italy, so I'll talk about the tips and tricks in today's part A. Again, just to make sure that you are updated. Okay, Tiara, part A and B, little okay, but C, same like the Atlantic Ocean. I like that expression that you're making. But mark my words, Tiara, if you are a person who have started reading as a habit, this Atlantic Ocean is not going to come. It is going to be there in your hand. Okay, so you will come and say. Nisha Keynes, no. Okay, Reshmi Bibin, good afternoon. Anil Kumar, how am I feeling? Yesterday you were not fine. Very, very sweet of all of you. Even though I'm okay, I'm just getting better, but didn't want to stop coming in front of you. Amala Joshi, good afternoon. So what are the things that you have to really look into? Okay, so as what you said, you would not attend my live session, isn't it, when I read in a very bland. See, the same applies to what you're reading. See, you have to read it by giving a lot of life. No matter whatever that you're reading, you give these ups and downs. Okay? Now, just to picturize this, I'll just show you once I start doing the part B. Okay? Because I'm going to do the part B, I'm just going to show the difference between how you read and what impact does it have in your life. Tangasudha, after some time, yeah, good afternoon. But no, I think you were there yesterday, sorry. So are you all ready for today's session? So again, I told you the impact of reading with intonations, okay? You start reading with a lot of love, affinity towards what you're reading. Whatever that you're reading, you read it with a lot of passion. It will come to you. The Atlantic Ocean is going to come in your palm. Okay, that's my promise to you, okay, Tiara? Good enough. Now, let's go and do what we are here for. Are you all ready for today's session? Yes? Monica, we are proud of you, sir. Even though you are sick, you come for life's sake. See, that is because you all are absolute stunning students. Okay, so we never want you to feel or feel left stranded at any given time. We're there. Each one of us in Neetu's family is there to make sure that you are all getting better and reaching your dream country. Abhirajan is ready, Kalai is ready, Kavita is ready, Anmol is ready from Italy, Monica is ready, Jilmi is ready, Angelina, yes, very good, very good. So as you all said that you're ready, now we have just made that small shift, isn't it? We're not going to present you with the timer. The timer will be, sir, we all pray for you because you are the best for so many. And thank you very much, Anil Kumar. It's an honor because when a student says like that, but we are just facilitators. You are the absolute doers. So we are absolutely proud about each one of you. Valarmati Reddy, not new name, I know that name. Hats off to you, sir, always. Love you. Thank you very much. I love each one of you. So it's how Neetu's family, it's the importance of being a family, isn't it? So Steny is ready. So now what is the change that we're going to do? We're not going to give you the timer. I'm going to keep the timer so that you will know how much quick the time goes. So that on the day of exam, because we don't have an individual timer, isn't it? So we thought, why not give you something out of the bloom, isn't it? Get you out of that, that comfort zone that is there. Exactly, we are eagerly waiting for your live classes every. I'm also eagerly waiting for all of you to be there in front of me. So as you said, you're all ready. The material will be popping up on the screen, and as soon as the material pops up, I'm going to keep a timer, and you're going to do. And as you complete the answer, just put a thumbs up or say done. Yeah? So the material will be popping up on the screen, and then we will see how many of you are going to bite the time or finish it on or before time. There you have the material, and the time starts now. Absolutely good enough. Kala is saying a lot of changed. Yes, who doesn't like changes, isn't it? So that's why in between the facial changes also are happening with Neetu's family, isn't it? Rather than having a very same phase of mind you have now, a lot of gorgeous faces coming your way, isn't it? So yeah, Abhirajan was the first one to say done. Very good. Valarmati done. Grishma Devasya done. Kavita Balaji done. Kalai done. Good enough, good enough. Excellent. Tangasudha done. Nice. Monica Vegas done. Good. Tiara, I'm set. Okay. Jalakshmi Ramesh done. Nice. Right. Angelina done. See, the response that you give is what makes us also more responsive, isn't it? When you are, how you are, it depends on how it impacts us. So Tiara, yes. Anmol, Italy, done. Hema Koshi, done. Ajit Kumar, done. All right, good enough. Now the most important question. Jilmi Joy, done. What is your answer and where you got that answer from? That what and where are the most important thing that I want you to let me know. What is your answer and where you got that answer from? Let's see. So the table, isn't it? You've been asking for us to give you tables, so we thought, why not? We'll give you tables for your choice as well. Eva Ivan. Eva, new name? Yeah, not sure. Done. Okay, Anil Kumar, done. Fair enough. Right. What is your answer and where you got that answer from? That where is important. See, it doesn't matter, okay? See, whatever you have got as an answer, do shoot. Doesn't matter what others are going to think. You are here to enhance what is the answer that you've got. So the first one I got from Grishma is A from the whole para. Okay, fair enough. Kalaya got C from an overall gaze. Okay, good enough. Gaze, okay, sorry. Fair enough. So A and C are the two options that is there in front of me. Now I have B. Am I happy? As a trainer, now I am super duper excited. Why? First three students have told me A, B and C. Now any student who's going to come and see this kind of Martin, James Martin and all, you have been there. He's another fraudulent spammer, okay? See, do not reply to this James Martin. He's trying to message and that is the only thing that they do. They try to rip somebody else's money. So please do not click on any of these kind of spammers. Just report them and ignore them. Understood? So again and again I repeat, this James Martin, Mark Williams, these are all people who are here to rip people's money, because they're all people who doesn't have their backbone, because they're trying to rip somebody else's money. Okay, so don't fall behind. When they message you, simply report them and block them. That's it. That's the only thing that we can do, because their job is to, because they don't have, they are like leeches. And it's the biggest problem that any one of us will encounter being in an online platform. So Mark Wilson, James Martin, all these kind of people who doesn't have the backbone, they're here to rip somebody else's hard-earned money. So they are leeches. So please do not respond to these kind of people. Just report them and block them. Okay, we have to be smart enough. And in between, I'm very sorry I missed a few of your answers. So Anil Kumar saying C, Gia is saying overall just Gia from Maldives, Angelina is saying C from the first part. Fair enough. Reshmi Bibin done. Gia C overall just. Tilakia, good afternoon. Nabi Rajan, okay. Fair enough. Smart. See, we have to be smart enough, isn't it? See, although we try to reduce all these spammers and people like that, but there are people who are there. See, in Malayalam there's a saying, so they know that we have students who are here with the purpose. They are students who are here to make their life more fruitful. So they come and start disturbing, isn't it? It's always there. So we know what to do. Kavita Balaji, C from overall. Okay. Josie Robin, good afternoon. Fair enough. Now, to show the difference between how you read and what is the importance of reading in a different way. Now see, the question will be popping up on the screen. As soon as the question pops up, Tiara is very happy. Okay, fair enough. I'm very sorry, I was about to sneeze. I didn't want to blow your ears off, so sorry for that. Nice probe. Now, okay, you like that manga, is it? Okay, fair enough. So now the question is there on the screen. Now see, if I read the question like this, okay, will you understand? The best description of the chart to DS to VSC score would be. Do you have any idea what I read, even though I read everything very prominently, isn't it? See, this is why we don't understand. Our brain doesn't understand the way that is individual. And English is not a language where you read individually. You will not understand the meaning. So read it together. That's called chunking. Okay, that's another important thing to enhance your 400. So how would you read? The best description of CHA2DS VASC score would be. Now what happened? Did you understand the first time when I read or the second time when I read? Definitely it will be the second time, isn't it? So the golden rule about reading is not what you read. It's about how you read. Understood why it is important that you start enhancing your reading, and this will definitely hit you onto your 400. Now, so golden rule of part B when you're reading. See, first and the foremost important thing is the thing called the strategy. The strategy of part B is called elimination method. So what is the strategy called? Elimination method. So what is elimination method? The elimination method means you're literally going to eliminate the answer option which is going to come your way, which you feel that it is wrong. That's it. Simple way of telling elimination. So now 3 things that you have to do is 1, read the question. 2, as you read the question, underline the keywords in the question. 3, understand the question. Very, very, very important. Okay? Unlike part A, which is your first thing that is going to come. When you're doing B and C, read the question, understand the question, underline the keywords in the question, then you go and see. There are 2 options after that. You can read the paragraph and then pick an answer. Or if you're like me, I read my answer options, underline my keywords in the answer option, then I pick it up from the paragraph. Okay, that is purely a student's perspective. So what is the question? The best description of, see, very specifically they are asking you about one particular thing and they are asking you about score would be. Now these kind of questions you have to read along with the sentence. So score would be a patient's history of cardiovascular pathology, or a score would be a score of 9 total points. A score should be the likelihood of suffering a stroke. So now what are they saying? Patient's history, total score of 9, likelihood of having a stroke. Now I know what it is. Now I have to search for my keywords also, isn't it? So now read it. In patients with non-valvular arterial fibrillation, the decision to start warfarin should be based on the CHAD S2 score. Now, is that something to do with any of our answers? I mean, the question? No. Our question is not about CHAD2 score. Our question is about CHA2DS2 VASC. Okay, so you have to be very cautious. This is why I told you understand the question. This aligns 1 point each for cognitive heart failure, hypertension, age 75 years and older, and diabetes mellitus, and 2 points for previous ischemic stroke or transient ischemic attack. So that is what CHA-DS2 scores are for. Now comes the question, isn't it? Now question is, the CHA2DS2 VASC score introduced by European Society of Cardiology provides a more comprehensive assessment of risk factors for stroke. It is better at identifying truly low-risk patients with arterial fibrillation and is now preferred over CHAD-S2. So this part has nothing to do with the question. Now, let's see what CHAD is talking about. So score, 1 point for congestive heart failure, 1 point for hypertension, 1 point for age greater than or equal to 7, 1 point for diabetes mellitus, 2 points for stroke ischemic and thromboembolism, 1 point for vascular disease, 1 point for age 65 to 75, 1 point for sex age category, that is female. Now let's see the elimination. So a patient history of cardiovascular pathology, yes, because it is talking about the cardiovascular pathology, because they are saying the score is introduced in the Department of Cardiology, provides a more comprehensive assessment of risk factors for stroke. So slightly pointing into A. Okay. Now it is better identifying whether it is truly low risk patient with arterial fibrillation or those. Now let's see, for me it is slightly pointing into A. Now let's see whether B is there or not. A score of 9 points in total. It is not showing that it is 9 points in total. It is showing about the maximum score. So that is not what the score would be. It is not to show that it is 9. So straight eliminator. The likelihood of suffering a stroke, there is not suffering, but they are assessing the risk factors only. Understood? So that is why C is also eliminated. Understood? So they're talking about a lot of things on the aspect. Yes, but the CHA score, that is not just about the comprehensive assessment of risk factors. It's not to predict likelihood of suffering stroke. So that is why C is eliminated. So congratulations to all the people who have got A, because A is the right answer. Good enough. I hope I've clarified your doubts about whether A is the answer or B is the answer or C is the answer. What do you think is going to be? Is there any doubts? Kalei, okay, you look surprised, but you don't have to, isn't it? You just looked into the aspect of getting an overall gauge. Abhirajan done, fair enough. Any doubts? Tangasudha clear? Good enough. Reshma is dancing. Good enough. I will always love those students who enjoy their achievement, as I've always mentioned. Monica understood. Good enough. See, you have to always remember B and C. The same kind of words which is there in the question to the passage. Most of the time it will not be. Grishma happy. Kavita clear. Angelina clear. Okay, good enough, good enough. Josie Robin clear. Alright. Excellent. Any doubts? If there is no doubt, we'll go to today's part A. What is today's part A? It's another lovely name, isn't it? Ashkrotme or Ishkrotme. or escrotamy. Anything of your choice. But generally, when I searched also, it's saying escrotamy. Kalei, I have tablets phobia whenever I see this kind of question. Okay, I go wrong. Not a problem. Now you don't have to worry about any phobia, isn't it? It's just a part of how you take it into. Take a deep breath and start finding the answers. You'll be all okay. Jayalakshmi clear, Jismol clear. Escrotamy. Okay, now the first and the foremost question is, how many minutes you took to complete? How you felt about today's material? That is the most important thing that I want you to let me know. Anil Kumar, clear, okay, good enough. Eagerly waiting to see that you tell me how you felt about today's material and how many minutes you took to complete. Because those are the important factors that we always take it into consideration. How a student feels. Tangasudha is the first one to tell me. She's saying it is easy and 12 minutes. Good enough. So how about others? Tell me how you felt about today's material and how many minutes you took. Anil Kumar, thank you. Pleasure. Kalei, thank you. Please take care of your health. Would do that. Thank you very much, Kalei. And please do take care of that lovely, serene Maldives life that you have in a resort, isn't it? Good enough. Ajit Kumar, 13 minutes easy material. Jia, Maldives again. 13 minutes. Okay. Sharanya, 12 minutes easy. Lakya, I did in 12 minutes. Excellent. Good enough. How about how you felt? Everybody is saying easy? Yes? Tricky Jilmian, 11 minutes. Fair enough. Kavita Balaji, easy material, 10 minutes and 42 seconds. Kavita Balaji is one who was always very precise. Exactly. The seconds also. Good enough. Right. So I have got a gauge about what you have told me. Now let's go and dig it in. I'm going to fire the 20 answers. I want you to take your pencil, tick, 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 tick. Start marking the answers. Alright. Now, see whether you like it or not. See what is the most important thing that you have to really look into. Because part A is the first thing that you will see when they give you the material. And again I'm going to remind you, please do not touch the pencil, do not touch the material before they tell you to do so. Let it be there, pray well, if you have ample amount of time. Okay, and once they tell you, then do not waste your valuable time, do as quickly as possible. Now, what are the things that you have to really look for? Because I have my new student from Italy, so I'm just going to tell you again. See, 15 minutes. 20 questions. That's the most important thing that you have to always remember. Okay. Now strategy also changes. It's called skimming and scanning. Scanning, of course, you're very much known about because you keep on using it on a daily basis. You're going to give a detailed look. Okay. So skimming means you're going to do quick look. So generally they say 1 to 2 minutes, but I'm a person who would always tell my student, try to do that in 15 seconds of time because that is enough because it's only small extracts. Now what are the things that you have to really be cautious when you're doing the first 1 to 2 minutes or 15 seconds? What are you to do? You're going to underline the keywords. What are you going to do? You're going to underline the keywords. Now what are these keywords? See, keywords are headings, subheadings, letters given in bold letters, italics, numbers, new abbreviation, bullet form. If it's a pictorial representation, your headings, proper nouns, these are all supposed to be keywords. Now, if you want to get more insights on the aspect of how to enhance your part A, we have done an exclusive video on the very same page that you're watching. Just it dates back a bit. But the easiest clue that I'll give you is that is a video which has the highest number of views so that it's easy for you to find. Okay, do that and hear it out, write it down, and always when you're doing a part, just go through that before you do. Okay, these are the things that I have to look into. Then do. It will come to you. Okay, now I'll just show you how to do very quickly how to skim through the text. So in part A, unlike part B, which I told you read the question, part A you're not going to go to the question. You're going to go to the text first. You're going to quick read it, understand the overall gist about it. And you should know what is the difference between A, B, C and D, because 4 texts will be different to each other based on one common theme. Right? So, I'm just going to show you skimming. You don't have to read word by word and all. You have to quick read it, just for you to get an overall gauge. An ischiorectomy is an operation which is in the opening of the made in the area of the skin, which is thickened and tightened in severe burn. Generally, the surgeon does a surgical knife, and the other technique that involves in the enzymatic treatment. And the skin is being removed, and damaged skin is cremated. Done on the part of more extensive procedures. You can have the ischiorectomy in the area of the body in the burn, such as face, chest, abdomen, limbs, and procedures like to perform a surgeon or plastic surgery is contraindicated, and the procedure would be actually more benefit, and it's recommended for the burn superficial and expected to heal with the surgical intervention done. I'm not saying all the words that I've written, but don't underline the word that you have already underlined. Waste of time. Likewise, you'll have to go through each text. So just to tell you, see, text B should be procedure. So any question related to procedure, where to go, text B. This is how you should differentiate. Okay, you have to underline the balance, I'm not saying. Now see, text C is about complications. So anything about the complication, go to text C. Now D, what are they saying? There's a different study kind of thing happening, isn't it? Burn, inflammatory mediator release, systemic inflammatory response. So anything on the aspect of something which is on the aspect of a study, go to a procedure kind of thing as mentioned in D. That's how you differentiate your each text. After this, you're going to go to the question. There are 20 questions that are divided into 3 types. So 1 to 7, this should be by hearted by each one of you. 1 to 7, these type of questions are called match the following questions. Okay? Now very simple. The instruction also should be by hearted. It says you can write any of these letters, A, B, C, D, and you may use any of these letters more than once. Very simple. You just have to use those letters. You don't have to even specify what is the exact sentence that you are going to get. Okay? So underlining keywords is here as same, because in part A you're going to absolutely refer the keywords. Now see, various techniques utilized in making incision after the affected area. So where do you think a lot of techniques have been used? During procedure? So where is during procedure? B. That's it. So various techniques used, they're saying it should be, see, if you have a surgical incision, longitudinal, horizontal, spiral pattern, all those things, that is it. So B. Factors leading to cellular shock. So cellular shock, I just read when I was doing D, isn't it? See, cellular shock is here. So that's the only place where I have that word. Do you really need to worry about whether it is factors mentioned or not? Not necessary. D. Understood? See, if your skimming is proper, 1 to 7 is a piece of cake. You can do it in 1 minute of time. Systemic complications linked to. So complications where? I told you how to refer, isn't it? Go to C. Complication is only mentioned in C. Now, is there anywhere which is mentioned systemic complications or no? Yes or no? It is there, isn't it? Systemic complication. But this is how you save time. Now, what scenarios would ischiorectomy deemed not deemed, so inappropriate? Just to split the question, isn't it? So where are they going to talk about this inappropriateness and appropriateness? Definitely during A, isn't it? Or in the A. Ischiorectomy is contraindicated, so something deemed inappropriate. That is it. So what precipitates electrolyte imbalance subsequent to a brain injury? So precipitate electrolyte imbalance. So where are they talking about electrolyte imbalance and all? Again, D, isn't it? Electrolyte imbalance. So something which precipitates, it's there in D. So you don't have to worry about which sentence. Where is it? Rational underscoring the need for antibiotic coverage during ischiorectomy or ischiorectomy. So where are they talking about all these importance of the need? Why is it need and all? It should be definitely in complication. So I'm saying it should be there in C. So I'm just going to see whether it is there in C or not, isn't it? So where are they saying? Where are the antibiotics? Bacteremia. If underlying ischiorectomy is performed under antibiotic coverage. That is it. Now, question 7. Responsibility delegated for the execution. So who is responsible? There are 2 people, isn't it? Plastic surgeon, traumatic surgeon, that is in A. Done. So it's as easy as what you can. if you really start underlining and start referring with the, because it's only synonyms. They just use a lot of synonyms. That's it. So I hope it is very clear. Now the next set of questions are called short answer questions, where the question number starts from 8 to 14. The instruction should be by hearted. The answer can be as simple as that of a word, short phrase. It can be anything between 2 to 3 words. It can be a group of numbers, or it can be a group of words, the other way around, or both. Tiara 7, good enough. Okay, it can be a combination of word and number as well. Strategy doesn't change. You're going to underline the keywords. Okay. Now, what consequence may arise from a reduction in intravascular volume? So, complication. Where are they talking about complication? Now, skimmed. Where are they talking about complication? It is there in D, or it is there in C. Consequences. So, is it C or D? Generally, it was supposed to be C. But here, there's a small problem with reduction of intravenous and all those things I mentioned. So where are they saying? Where are they saying about? It is in decreased intravascular volume complication. So hemoconcentration. No, not hydrostatic microvascular. Decreased intravascular volume. So what is the complication? It is leading to hemoconcentration. Centration. Clear? Aside from specialists in plastic surgery, who are proficient in performing hysterectomies? Definitely, there is only one place, isn't it? Go to A. Who is the next one? Trauma surgeon. With or without the article is fine. Why? Short answer question. A trauma surgeon or trauma surgeon. Anything is an okay answer. Question 10. What instrument is utilized for both pressure measurement and procedural guidance? So what is used? The instrument used. Where are they talking about all these instruments? During procedure? So let's see if there is anything mentioned during procedure. Sometimes a manometer is used during surgery to measure pressure and help you guide with the procedure. So the answer is manometer. M-A-N-O-M-E-T-E-R. Excellent. Question 11. What might be observed in diminished quantity, decreased, due to hemodynamic shift resulting from elevated extracellular fluid levels? Again, something to do with D, isn't it? So, hemodynamic changes decreased. So, what is it decreasing? It is going to decrease your cardiac output. C-A-R-D-I-A-C-O-U-T-P-U-T. Question 12. What causes the exposure of the underlying viable tissue which may desiccate if left unprotected? So where are they talking about? Unprotected, all those things. Definitely complication. Yes? Now what are they saying about? Desiccated, then exposure, viable tissue. So what do you think are the answers? What do you think is the answer? The answer is therein C. So exposure of underlying viable tissue becoming desiccated. So which one? Inadvertent fasciectomy or fasciotomy. Clear? So INADVERTENT is the answer. Good enough? Hope you're on the very same page with me, yeah? The next question. How much would be the measurement of the area of the skin requiring release? So how much? Definitely during procedure, they're saying the area of the skin that need to be released is about 2 centimeters. So it can be either 2 centimeters or about 2 centimeters. Anything is an okay answer because CM is given. You're always welcome to use the abbreviation because it is mentioned in the text. Alright? So what potential complication might arise due to burn injury in the abdomen? So abdomen means, so where are they going to talk about? Anything on the aspect? So complication. So The respiratory comprises in chest and abdominal compartment syndrome in the case of an abdominal burn. So what is the complication? Abdominal compartment syndrome. So ABDOMINALCOMPARTMENT is a 3-word answer. Now for the next set of questions, the final set of questions starts from 15 to 20, and these are called fill in the blanks questions. Instructions remain very similar to that of short answer question. It can be a word, short phrase, words, numbers, or both. But here you have to be very careful with redundancy. You're supposed to be very cautious. Even a repetition of article which is next to the word that is needed, it can cause you lose marks. So be aware. So surgical smoke emitted by an electric knife during ischiorectomy and in burn surgery contains complex toxic hydrocarbon byproducts. So where are they talking about all these byproducts and all? Again, complications, isn't it? So hydrocarbon is there, electric knife is there, ischiorectomy is there, surgical smoke is there, all those things are there. What is the only thing which is missing? Necrectomy. Necrectomy. A very straight answer. Question 16. Upon induction of general anesthesia, see this kind of article, the is already given, isn't it? So will be removed and the team will ascertain your respiratory ease prior to transferring you to a recovery area. So where are they talking about all these important keywords? So again, go to B. So once your procedure is complete, anesthesia stopped, general anesthesia, this is one of the keywords, your instead of that, they have changed it to the dash will be removed and taking you to the recovery area. So the answer is breathing tube, a 2-word answer. BREATHING TUBE is the answer. Again, there comes another spammer, okay? Adrian, say, all these, just report. Okay, these people are only here to rip your money. So please ensure that these kind of people are reported and, okay, these are people who doesn't have backbones, isn't it? They try to rip somebody else's money. So just report, yeah. Fair enough. Now a different approach entails. See, this kind of entails and all are very, very prominent word. You have to start using it. See, it should trigger some eagerness in learning. Entails. Why is it entails? Okay, so what involves applying enzymatic treatment to the skin, chemically eliminate dash. So what are they talking about? What are they going to eliminate? So where are they going to talk about? Definitely in A, because it says, so enzymatic treatment, skin, chemically remove the damaged skin. So the answer is again a 2-word answer which says damaged skin. DAMAGED SKIN. Unlike the closure of wounds with stitches, ischiorectomy involves covering the incision with a dash. So again, these kind of articles, is already given. Okay. Now where are these answers be? Let's see, it should be there in B. So what are they going to talk about? They're going to say about, see, the solution will be careful and, see, closed stitches covered with us here. So what is the only thing which is missing? Surgical dressing. SURGICALDRESSING. Let's just picturize this. If you don't note this and you write a surgical dressing again, see, this is called redundancy. Already that is there, so this answer will be marked as wrong. So be aware of this, yeah. The penultimate question. And ischiorectomy is not recommended. So not recommended if a burn is dash or is expected to heal independently. So where are they talking about all these independently and all? A, isn't it? Because they're saying it's not recommended, superficial, or is expected to heal without surgical intervention. That means naturally. So superficial. SUPERFICIAL. The ultimate question for today. The cascade. Love that word, cascade. You have different things depending on where you use it, okay? See the cascade. In here, the cascade means the cluster. of hemodynamic alteration precipitates hypovolemic shock subsequently. So that means followed just after seguing into. See, these are all just to pump in a lot of vocabulary. See, once you finish this, go back and search for these words. You will understand, okay, why it is seguing into dash. So where are they talking about? Definitely, so hypovolemic is here. All those things are here, here, here. So seguing, following a burn shock. B-U-R-N-S-H-O-C-K. So I have wrapped my 20. It is high time that you start telling me. If you have any doubts with regards to any of those questions, please do let me know. If not, as always, I'm eager to see how much of a score that you have got. Please do shoot your total scores. Alright? Eagerly waiting. If you have any doubts, you're always welcome to clarify. Alright? Right. So always remember, whenever you are attending something online, you have to be very careful. Yeah. Very good. Tiara is happy. 18 out of 20. Good enough. Jaya Lakshmi 20 out of 20. Absolutely good enough. Abhirajan 20. Excellent. Nisha Kains 18. Ajit Kumar 18. Lima 19. Stunning scores. Tijo 19. Very, very, very nice. Sharanya 20. Excellent. Josie Robin 18. Anmol. Anmol, did you increase from Italy? You said 12. Now you have got 15, isn't it? Just by practicing certain things, you have got 15. So do not tell that, okay, I am only getting this. You will definitely hit 20 out of 20 in no time. So Anmol from Italy, Turin, isn't it? Kavita Balaji, 20 out of 20. Very, very good. Keep it up. Right. Any doubts? I don't think that you will have any doubts. So until and unless I see you all tomorrow, it's adios from me. God bless you all. Take care. Bye.